WellPoint, the nation's second largest insurer, has a new plan to rein in costs. According to today's Wall Street Journal, WellPoint will start paying oncologists $350 per month for each patient who is on the insurer's recommended treatments. The plan is being viewed by some as transformational, by others as controversial. Joining us now to discuss this, Dr. Sam Nussbaum. He's the Chief Medical Officer at WellPoint. And also joining us, Craig Garthwaite, Assistant Professor at Northwestern University's Kellogg School of Management, where he specializes in healthcare. Gentlemen, thank you so much for joining us on this very important issue. Dr. Nussbaum, let me begin with you, because this is a program that you've overseen. Everybody wants to cut costs, understand that insurers want to do this, hospitals want to do this, but when you think about someone's cancer treatments, it just doesn't seem like a one-size-fits-all plan will necessarily work. Each person is different. Why do you think this is going to work? And do you expect any pushback on this from doctors and patients?
Susie, I'm pleased to be with you speaking about something as important as cancer care. We know that cancer can be a devastating illness, and yet it can be one that is treated. We took on cancer care because, number one, we know that about a third of individuals with cancer don't receive state-of-the-art care. We also know there are just breathtaking new genomically targeted therapies that we want patients to have. Yet, we believe that the current payment model doesn't allow physicians to always prescribe the most cost-effective, the most clinically effective, and the most patient-centered therapies. This program will begin to make a difference, a program where we're paying an enhanced fee for doctors to use evidence care. And there are 60 different clinical pathways. This is not a one-size-fits-all approach at all. These are specific treatments developed by some of the nation's leading oncologists that will guide the very best care.
Right.
Craig Garthwaite, do you buy what Dr. Nussbaum just said? In other words, that this plan to incentivize doctors to follow a certain protocol will actually improve care?
So I think overall it's good that we're trying to get a handle on what we spend on cancer drugs. We spend about $100 billion a year on these medications. It's one of the fastest rising categories. And this is a step towards that, because right now we see sweeping variation in how doctors prescribe care, not all of which is attached to clinical outcomes. That being said, I think we do have to have a little bit of a note of caution here, in that this is only going to be effective to the degree that we have insurers competing with each other to make sure that we're providing cost-effective care, not just low-cost care. And so we want to have a robust and competitive insurance market that allows patients, if they're unsatisfied with the decision their insurer makes, to vote with their feet and move to another insurance company.
Mm-hmm. You know, Craig, a few weeks ago, you were on our program, and we were talking about this new move towards reference pricing, where insurers are going to put a cap on what hospitals can charge for various procedures like hip replacements, knee replacements, things like that. And now this thing with cancer care. And from the point of view of the consumer/patient, there's this feeling of kind of like price controls that are coming into the U.S. healthcare system. What are your thoughts on that? Are we moving towards that?
So it's very clear we're not moving towards price controls, which I think of as sort of the government coming in and by fiat saying this is what we're going to pay. Instead, what we're really having here is a robust marketplace. And so it's good that insurers are going to push back against pharmaceutical companies and the prices they want to charge. And as long as we have a robust set of insurers competing on this could lead to good outcomes. But there are lots of markets in the United States where insurers have a lot of power. And we need to be careful in those markets that insurers are making the best choices for their customers, and their customers being patients.
Dr. Nussbaum, in today's Wall Street Journal, you're quoted as saying that the payments for physicians are aimed at ensuring that the best drugs and the best protocols are being compensated, and that we're creating, quote, revenue neutrality so better care can be given. Forgive me, doctor, but when I think a lot of people hear that, they think that it is a big for-profit insurer selling them a bill of goods, specifically that insurer is potentially more concerned about its earnings stream and maybe about the $17 billion pay package for the company's CEO than it is about my individualized care. Why are they wrong to think that way?
Well, Tyler, first of all, this is a voluntary program. Every oncologist can continue their current treatment patterns using the drugs that they find most effective for their patients. But today, remember that oncologists make about 70% of the revenue for their practice based on a % of the drugs they prescribe. All we're saying is let's create a democratization over pricing. Let's give doctors that follow the pathways developed by their experts the opportunity to make as much money and give the right care for their patient.
All right. I'm so sorry, Dr. Nussbaum, to cut in, but we have to leave it there. A very interesting conversation. Thank you so much. Sam Nussbaum with WellPoint and Craig Garthwaite with Northwestern University's Kellogg School of Management.